Hello, my name's Will Schweizer, and today I'm going to talk to you about my research report entitled Technologists' Influence on Claustrophobia in the MRI Environment. Do we really make a difference? So my central research question was, how much influence do technologists really have over claustrophobic MRI patients? And are they able to get the patient through the test? Are they not? How much influence do they really have? So why do MRIs induce claustrophobia? Well, I have a photo here to illustrate what an MRI is like. This is what they call a closed MRI. As you can see, it's quite restrictive. This particular one is quite dark inside. I'm not sure if they have fans blowing, but it's probably quite stifling as well. So you can imagine even someone who is not clinically claustrophobic could feel some anxiety in that space. And in fact, up to 30% of patients do feel some kind of anxiety before or during the test. And somewhere around 2.5% to 3% of patients cannot complete the exam at all due to claustrophobia. And this may not seem like a big number, but worldwide, that's some 2 million studies, and it represents a loss of billions of dollars. So my hypothesis was that through training and various tools, that the MRI technologist was really the most influential and the most important person in trying to get a patient through a test, and that with the right tools they should be able to get any patient through an MRI scan. So the specific areas where technologists can make a difference, there's identification, there's the reassurance of the patient of the validity of their condition, positioning. We have various distraction technologies available to help get the patient through. There are advanced rapport techniques that the technologist can use as well to help get the patient through. So in terms of identification, why is it important? Well, if you're able to detect that somebody is claustrophobic, it gives you more time and really the opportunity to help get them through. There has been a simple 9-question survey identified to help identify which patients are actually claustrophobic, because if you say claustrophobia to somebody, there could be varying degrees of what that really means to them. And somebody may say, oh yes, I'm terribly claustrophobic, and then get through the test just fine without any help whatsoever. So it really depends on their patient's view of what that means. But by identifying early, we have the chance to do something about it. Once it is identified, it's important to assure the patient that it's a valid medical condition, as well as the fact that there's some biological processes going on in the body, so it's not just all psychological. In fact, they have studied the link between cortisol levels and the claustrophobia induced in the MRI environment, and found that when patients get anxious about being in an enclosed space, their cortisol levels rise. And these cortisol levels are a hormone that's known to be involved in the fight or flight response. So the patients legitimately feel this panic that overcomes them in the MRI environment. As far as positioning, there are typically several options available for most MRI scans. I have a picture here illustrating one. This patient is in what they call the prone position, which is them lying on their stomachs. She's probably having some kind of a lower extremity scan done, maybe a knee or an ankle or possibly breast. It's hard to tell. So in nearly all the research that I looked at, they mentioned prone positioning as one way to alleviate claustrophobia, because instead of having the patient looking up at the top of the machine, instead they're looking out at possibly a window, or possibly a family member in the room, or even just light, whereas instead of staring up at the top of the machine, you're looking at light outside. As far as distraction technologies, there are a number of things available for patients to help take their mind off of what's going on. the most popular and the most widely used is music. It's available on nearly every modern scanner, either through a headset or through speakers in the room. And patients can listen to the radio, they can listen to CDs typically. Often they can bring in their own device like an iPod, and we can connect that and play music for them that way. Secondly, there are AV systems, meaning audio video, and these are typically seen with pediatrics. In fact, when I was studying at the Children's Hospital in Philadelphia, they had a system where there's glasses and a headset, and kids could watch their favorite movie or television shows, and it took their mind off and helped get them through. In fact, there was a good study done at McMaster Children's Hospital in Ontario where they directly compared the use of these AV systems with sedation, and they found that by employing these AV systems, they could reduce the need for sedation by 15%, which more than paid for the cost of the system. As far as going forward, there has been some research to show that a VR system, or virtual reality, can help reduce claustrophobia. In Spain, there was a study where they directly compared music and a VR system in a mock MRI scanner, and found that for a claustrophobic patient, the VR system got them through where the music did not. So there are no commercial virtual reality systems available yet, but I wouldn't be surprised if we see that in the future. There are also advanced rapport techniques that can be used. Patients were found in this one study to spontaneously close their eyes and visualize themselves somewhere else during the scan, up to 35% of them. So knowing that, technologists can encourage other patients to do the same. Secondly, there are other techniques including blindfolds, mild hypnosis, avoiding negative words. Patients get a squeeze ball to hold in their hand, and when they squeeze that, it sets off a little buzzer, and the technologist knows to stop the test and check on the patient or just pull them right out. That's often called a panic button by technologists, where they found that by changing the wording, avoiding words like panic, instead calling it a call button, that can help with claustrophobia. There's been one study to suggest that formal training in these anti-anxiety techniques could be extremely helpful in reducing claustrophobia. In this one study by Lang, Ward, and Lasser in 2010, they found that by using these techniques, they were able to reduce early terminations by 25%, which is a huge gain. So despite technologists' best efforts, I've discovered that they don't always have control and they can't always get a patient through. Sometimes sedation is really the best option. The most typical thing used for sedation is a class of drugs known as benzodiazepines. These include Valium, Xanax, diazepam, and they've been shown to be very effective. In one large study, 55,000 patients, it was found that when sedation was used, it was 99.7% effective. The other concern with MRIs and claustrophobia is not only simply getting the patient through, but the quality of the exam. MRI requires complete compliance, it requires absolute stillness throughout the test. So if somebody is anxious, the chance of them moving is increased, degrading the quality of the exam. So it was found that when patients and technologists kind of force them through, not using sedation, that the image quality was degraded. They could possibly miss lesions, miss other pathology. So there's another reason why maybe not every patient should be pushed through, even if you could. So in terms of taking all that research and putting it together, it really warrants a comprehensive strategy where you do train the technologists and give them the tools available to help distract the patient, to position them in a way that relieves claustrophobia, to identify claustrophobia, reassure the patient, to use these advanced rapport techniques, but on the other hand, have the ability to bring in sedation when necessary by either having a physician on site or working something out with the doctors, the ordering physicians beforehand. But to really recognize that although as technologists we can certainly help and reduce those numbers of patients that can't make it through, there still is a need for sedation there. In terms of the next step, I'd love to see some sort of a feasibility study of implementing such a program into an imaging environment. There could perhaps be recommendations made to the ART, which is the American Registry of Radiologic Technologists, or the ACR, the American College of Radiology, to study how such a program could be implemented. Thank you.